Right. So, ladies and gentlemen, welcome to Eureka Health Podcast. My name is Toby, your host. And today I'm hosting a special guest. Welcome to the podcast, Jimmy.
Thank you.
I don't know whether that's the name you prefer to use or
yes.
So, Jimmy, introduce yourself to us, please. Who is Jimmy?
So, my name is Jimmy Lionel Omaset. I'm a staff nurse here in the United Kingdom, but of course, originally from Kenya. Born and bred in Kenya, specifically Malaba border. So, our home is practically in the border in Kenya. Did there my primary school, my high school. Went, of course, to the Kenyan Medical Training College and came to the UK after practicing 3 years in Kenya. So my family is in Kenya. I'm here with my wife, and that's a summary of basically whom I am.
Oh, awesome. How did you find yourself in the UK? What inspired you to migrate or to seek practice in a different country? Almost like starting all over again. What was your inspiration?
The main thing that made me leave is that I had worked in Kenya and I had reached a point whereby I was the nursing officer in charge of this level 4 hospital. And whenever you go to these meetings of in charges, I would be the youngest person there. The people would be 50s, 60s. So I was asking myself, I'm earning a lot of money. I'm meeting people who are 60s. I think I have achieved beyond what my age mates have achieved. I want something that will challenge me again to grow. So I decided to look for a job in a government hospital so that I start like in the middle level like my peers and get this challenge for me to be better and better. But I couldn't get a job. It was so corrupt everywhere I'm going. They want money and so on, but I wasn't willing to get a job through the back door. So I decided, no, it feels like this tank I'm a shark in this small tank. Let me go out. Then I remembered I had this dream that I wanted to go and study outside the country. And I said, fine, because I did my nursing in the Kenyan Medical Training College, I'm going to apply for a bachelor's degree in a university outside. And I said, okay, where can I go in the shortest time possible? Because I feel like I've had enough in this Kenya. I've gone for job interviews. They're asking me for bribe. I don't want to bribe anyone. And in my current workplace, I was enjoying, but I felt like I wanted more because I was doing office work then. And I think I'm oriented, more clinical than office person at that time, and I felt like I was young. I want to do more. I was just 24, 23 years old by then in 2021 and 22. So I said I wanted a bigger challenge. So I said UK. When I researched the process of all the countries, I saw that UK can take the shortest time possible. Yeah. So I said, okay, I jumped into it, did everything quickly by myself. Actually, I did everything in the process myself. Did my IELTS, got my passport, got everything, processed everything. Within 4 months, I was in the UK. And I had already applied for the bachelor's degree in one of the universities here. So I just reached here, worked a few months, paid the deposit and started and got done with it. And yeah, it's been step by step since then.
Oh, that's nice. So actually, one thing people don't realize is back home, you have the brains, you have the talent, but then you don't land the jobs easily. But then even if you land the jobs, you hit the ceiling very quickly. Like first of all, you do everything, which is it's a good experience, and it's the opposite of what of the practice in this place. In this place, everyone is sticking to their lane. Even within the nursing fraternity, people are so specialized that they wouldn't even want to touch anything else. But for us back home, it's all round. I remember watching your videos. Would you mind just summarizing where to start from and what to do for a person back home who wants to practice outside the country?
Good. I don't mind sharing. Now, a lot has changed since the time when we were coming and how things happen now. So initially, there were agencies that were recruiting people and then bring people to the UK, now to the several NHS trusts and the private facilities and care homes. And then it came to a point whereby Kenya was listed in the amber group of the migration with the WHO healthcare migration. And then we had a problem. The healthcare agencies could not recruit anymore. So fast forward to this time now with the visa issues in the UK and so on, a lot has changed, like regarding the numbers that will come from abroad and the process and so on. So as we speak now, I'll speak about the process now, leave alone, because all the other routes have been closed. The agency plus the one who could do most of the things really yourself the way I did. So what is happening now is that For someone who really thinks they want to come to the UK and this is something you're passionate about, number one, of course, is the decision that I really need to move. But again, you want to evaluate yourself and have goals. I think one of the things I insist on is that as you move, have some objectives. What do you want to achieve? It's not just moving because everybody's moving, or moving because you want to be said that that you are abroad, just for the sake of the name that, oh, you went abroad. So context also matter. Where are you in life? What are you doing? And this country you want to move to get information that based on your situation, how will you settle in there? Will you achieve your goals in there? And as you move to England, what exactly do you want to do? I have friends who left Nigeria, for example. I have a couple, husband and wife, they were anesthetists in Nigeria, and they were doing very well. They left their 5-bedroom house and 3 cars, sold everything, moved to UK. When I asked them, why did you leave Nigeria to come here? They told me they wanted their children to get UK education. That's why they moved here, and they are nurses, all of them right now as we speak. So that is the decision they made as a couple. Other people came to study. Husband and wife wanted to study here, and the children could just join the system as well. But so as a young person, I could use myself. I had this goal. 1, I want to get the degrees to study. Number 2, I want to get the experience, because in the future, we would want this experience to land in Kenya. And I'm one of the people who have the mind to practice a bit, go home and have a facility that gets the quality here plus that can improve something at home. So basically, and the experience plus the academics, learn from them, take it back. So that is an object. There's me and there's other people. So you set goal first. Get as much information as possible from the ground. Research on yourself. This is what people say on the internet. Search for information for yourself. Spend time on the Google and understand things. Watch YouTube videos and then know what to do. That's number 1. Number 2 now is understand the process. 1, the NMC, as I highlighted, it is clear if you're a nurse, for example. Let's use the example of a nurse first, because that's what I understand better. Go to the NMC website, the Nursing Midwifery Council. You can do a self-check in there. Once you do the self-check, it will tell you the documents you need for you to be registered. It will tell you one of them will be the IELTS exam. It will be the Nursing Council certificate plus your Kenyan, if you're in Kenya, plus the college certificate, or if you're in Nigeria, still the council and the college, whatever country you come from. After that, they'll ask for your identification, which is your identity card or passport. But for most of us coming from Africa and Middle East, we need passport. EU, they will need maybe other forms of ID. I don't know. And after that, they will need experience. Is it 1,800 hours, I'm told, that the NMC needs? Initially, they said you don't need any experience.
Yeah,
but I think there are updates somewhere right now.
There are a few updates on that, yeah.
Yes, they need experience right now. So those kind of things you see. Once you do the self-check, you are able to determine what do you need, or if you have everything or not. Then you can make a choice. You want to start the English test first, or the nursing CBT one first. Which one?
Yeah. Actually, the biggest step that people get stuck on is the English test. Once you pass through that, I think the rest flows very, very quick.
You are right.
Yeah.
You are right. So there is one of my friends did the IR 7 times.
Oh, that's...
And another Indian friend said that she did 17 times.
Oh.
Yes, and it costs a lot of
money.
Cheap. It's not cheap.
It's about $200. 200 pounds, I think.
Exactly. So once you've done the NMC thing, it has told you the details you need. While you look at those things and determining the exams you want to do, you also plan yourself financially, because you don't just jump into it. You want to analyze how much do you need for all these processes. And apart from that, after you've gotten everything in their papers and you get a job, the migration part of it requires money from your own pocket as well, to do some other things, plan yourself, to organize yourself. Your employer may not be financing your settlement in the first weeks or so. You may need to organize yourself. If they're doing even 2 weeks, for example, you need to take yourself from there until you get a first salary. Those kind of things you need to organize yourself. But if you come down into the real practical thing to do, once you've done that, and you have your IELTS and the NMC part, the next thing that you need to do right now as you speak is that, because we have said there is no agency recruiting, it's you spending time on the internet looking for those jobs. Are jobs there? Yes, they are there. However, recruitment is very minimal at the moment. Initially, we used to say they take 1 out of 10. But right now, it could be 1 out of 30 because of the salary threshold, which has been increased, plus prioritization of visa. I think priority of visas someone whispered to me that they give more to people who are coming for medical reasons and those who are coming to the students and those kind of people who are likely to spend a lot of money on the economy. That's what somebody whispered to me.
Yeah.
So jobs are still there because I have someone who came last month actually. So it means jobs are still there. But if you're willing to do the hard part, the hard job of looking for the job, spending time on the internet, let me tell you, because I did this for myself, I used to come from work at 9 o'clock. I apply for 10 jobs every day. I committed to 10 jobs every day. I sleep at 3 o'clock. 10 jobs per night.
Wow.
And I applied for 400 before I got 3 jobs at the same time. And
400 applications.
Yes.
And there are some people who do like 5 applications and they think they've applied for too many. They give up.
Yes. So you must be ready to do the hard work and apply for hundreds and hundreds. Even the Bible says, cast your bread on many waters.
Exactly.
Do that until there is this one day you'll just get one if you don't give up. Do your thing slowly in Kenya or wherever country you are, but keep applying. Keep on. When you're pursuing something must be driving you for you to be ready to give in everything you need to, whatever you want to get. Something must drive you for you to be passionate and mad about it. So application, you must apply hundreds and hundreds. This applies to whether you're applying as an engineer, vets, because they're recruiting vets right now as we speak, as a scientist and those kind of people. You must be ready to do the hard work. Then visa, of course, and everything will flow. Once you get the job, the employer can guide you from there, or you can get information easily online. It's easy.
Yeah, so it's quite a process. It's just getting a little bit harder, but still it's possible. If you put in the work, if you put in the preparation and the determination, you can still get it. Yeah.
That's right.
So thanks for those insights on the migration process. When you came, what are some of the things that took you by surprise in terms of adjustment to a new country, a new environment, a place you've never been before?
Well, I think one thing that helped me settle, there are 2 things that helped me settle. Before I came here, I looked for a church that is nearby the place I was staying, a Baptist church, which I joined. And people have been welcoming and they've become family to date. That is number 1. And then number 2, when I came to work, we came as a cohort. And the trust found a place for us to live, a student village. So because we were living together, 6 of us in an apartment, it's like an apartment that has 6 rooms inside. So we were living in there, everybody on their own, but we share the corridor and some sitting room somewhere. So we made good friends out of that as well. So it helped us to have some friends to start life in. But so number 1, making friends is very difficult. Everybody's on their own.
I know.
So it's difficult making friends. People are not as friendly as it is back home. Wherever we come from, Asia, Africa, whatever, it's not easy. So you will be alone most of the time. Number 2, the weather is so bad. The weather is the worst thing I'm dealing with, leave alone the friends parts. The weather. As we speak right now, the temperature is 9 degrees. But if outside, the actual feel is like it's -9, not the positive.
I know.
The actual feel outside.
It shows 9, but the feeling is different.
Yes.
What you feel is totally different.
True. So that is number 2. The weather is bad. Making friends is difficult. Number 3, food. Food, the kind of food I used to eat at home is not available here readily. So mostly my diet consists of pork, eggs, rice, bananas. Thank God for the Indian shops. I can buy a bit of food there like bananas and yams, those kind of things. Yeah. And so I can get some food there, but my food choices are so narrow, limited. So I have a problem with that. That's the third thing. Number 4, I was using bus transport initially before I bought my car. And I would get into the bus in the morning, and there are so many universities around here where I'm living and colleges. And you get into the bus in the morning, and the students are smoking. Everybody is smoking. The bus, everybody was doing this. So me, I was like, oh God, when will I buy my own car? Because you're going to work in the morning, it's 8 o'clock, those times. And I can't wait to come down with that bus or light, because the environment is not conducive for me. Even where we were living, it was the same thing. These people would be standing out there smoking, and that smoke is so that's the thing I didn't like again. And then number 5, now getting to work, is that it took me a while to get used to a few things. For example, 1, the workload was is bigger and heavier in my current workplace. I've been in the same workplace since I came. The workload is heavier. And number two, you don't just make friends at work just like that. You know, the way we used to be to do in Kenya. No, everybody's not your friend just like that.
Yeah.
So you need to be very careful with people. Even what you say, wherever you are, it can turn against you. You make, the things you do, the things you need to be very careful. The comments you make, even around the patients, you know. So I almost got myself in trouble. I'll give you an example. For example, when I was new, I was assisting a patient. I gave medication, I gave everything. The patient said, I'll not have a wash. I can have a wash when my partner comes later. I said, oh, I'll give you the things when he comes around. So see, when I put that he in there, like the he.
When he comes, yeah.
But the lady said, no, it's a lady, it's a she.
Oh, yeah.
So she mentioned it to one of my seniors, and I had to come and apologize and withdraw.
Oh, yeah.
Yeah, so I had to apologize and withdraw because I said he, insinuating that her partner is a man.
Exactly, yeah.
So it was an assumption on my part.
Yeah.
So I learned to be very sensitive to be using the word partner henceforth.
Yeah.
And avoiding
he, she.
The he or she to be safe.
Yeah.
So those are the kind of things that I made that there are so many. I may not remember all of them at the same time, but this is just part of another one. You need to, you don't go to your friend's place just like that. You need to call and make appointments to meet.
Exactly.
Even if you're in the same flat, it's next door. No, you don't just go and knock.
Yeah.
Tell someone you're coming, call.
Yeah.
Exactly. Make appointments. It's not a social aspect like that. So there are many, but these are just a few.
Wow. So lots of adjustment when you move. And in terms of the reality of life, I know there are people who are really bent on traveling or migrating.
Yeah.
What would you say to them in terms of the reality of life, or what would you say about that?
Yeah. So I think circumstances differ from person to person. Initially, as I said, you need objectives that are making you leave home. What do you want to achieve in the country you're moving to? You need to have something. You don't just move carelessly. Now, what I would say is this: after being here this is my 4th year now in the UK, I can say that my life in Kenya and how I'm living here now, there are certain areas of where my life was better in Kenya, and there are a few areas which my life is better here. Number one, if I look at it in terms of the income, the money I was earning in Kenya, I was doing much more with it than what I'm able to do here, with what I'm earning here at this time. There are certain people that, if you look at in terms of what they're doing and what they're earning, it's not worth it for them to come and start here as a band 5 nurse, for example. It's not worth it. I have a few friends who've come and regretted, but they can't go back because of the shame and so on. And this kind of thing, what people at home will feel about it when they go back. So I want to say this. If you're in Kenya, for example, I'm using Kenya because I understand Kenya and I come from Kenya. You are working in Kenya. You are a nurse, let's say in a private hospital. He's paying you money like 80,000, for example. You can pay your rent. You're able to save. You're able to do your bills, and you have no financial objective that is taking everything from you, and you feel like you're just comfortable. I think stay there. You have a comfortable workload at work. You have a good manager. You're being paid regularly. You can comfortably pay your bills and have something small for your savings and for your circle. I think you should stay there. Because I can almost say 9 out of 10 people are living hand to mouth in the UK. Because if you take an average person's payslip, for example, and look what enters your account versus what
lives.
I
know it is. You earn more. You earn more here than in Kenya or in the other countries.
On paper,
but in terms of expenditure, the value of the money, what you can do with the money, it's totally different. You can't compare with what you're earning back home and what you can do with that money.
True, I agree with you. That is the thing. So by the time your salary comes, okay, council tax, pay the rent, pay what. By the time everything has left and you pay the bills and everything, and your food, there is too small amount remaining. That's why people have to work 2-3 jobs, which is still very difficult to do. I'm telling you, it's not easy working 2-3 jobs. It's not easy. It's not easy. So you end up straining. People are so stressed. I can tell you nearly everybody is stressed in this country. If you add the work stress plus the money issues plus the weather, nearly everybody is, at least the stress levels are so high in this country. And I suspect, I want to do a paper and research, I think, in the future. Why are really people giving birth to, autistic children? Autistic children are so many in this country. I suspect part of it. Yeah, I think part of it is due to the stress levels people are going through. I just suspect. I'm not sure.
Yeah.
But I suspect
that needs a study, actually.
Yes. I'm thinking of how to do it. I was on ChatGPT wondering how I can do a paper on 2 things. 1, the autistic thing, and 2, on the issue to do with the drugs. How the hospitals are contributing to people getting addictions outside. Because I'm seeing a pattern somewhere. So those kind of things. Because people are stressed. They have to go to the hospital. They give them medication after medication and so on. On the other hand, I'm telling you, so all these issues contribute to that, financial issues and so on. So if you're comfortable in your home country, stay there. Number 2, if you don't have a clear goal that really has to make you leave home, clear one that it's not about the passion or anything driving you from home. It's not, just stay home. I think people need to consult each other, consult people who have moved and experience, ask questions, consult 3, 4, 5 people, not just one person, but take them on the Google also, and all social media, whatever, get information clear, but don't just move aimlessly because everybody's moving.
Yeah. You have to have an objective.
True.
Yeah. Of course, the good part would probably be about the education system, the health system.
I'm happy you're saying that, because there is, anywhere you go in this world, there is the good, the bad, and the ugly.
Yes.
Even my village, same. In your village, same.
Exactly.
In our city, Nairobi,
everywhere.
Same. Where I live, same. So what you mentioned, education is good, healthcare is good. Anyway, except the outpatient. I don't like the outpatient because by the time you get an appointment, it takes forever. If you go to ED before you are seen, forever.
It could even take years.
For years. Anyway, it took me a year to get a doctor's appointment for my chest. 1 year full, 13 months actually. So that's an example.
Yeah.
But once you get the care itself, the doctors will attend to you well. The equipment is good. They'll assess you, good the bloods. If you're admitted inpatient, you'll get good care. Schools is good. Roads are good, and a few potholes, not like our place where we come from. The roads are good. Generally, security is good. Rarely would you hear like an issue. The systems are efficient. Most places you go. Government offices. And the best thing I'm happy about UK, by the way, is not the things I've mentioned even. The best thing is this. If you apply for a job and you are qualified for it, whether you are which color, you'll get that job. Whether you are brown, white, yellow, green, whatever you are, if you are qualified, you get the job, you get it. It's not about where you come from. Everybody gets equal opportunities on this. I'm not biased. I'll not be biased on this one. In my experience, that is it. Yeah. You are qualified for it, you get it. You deserve it, you get it. There is no shortcut to those kind of things here, and I'm happy about it. I may not know much about elsewhere. Maybe
no. It's based on it's based on merit. Yeah, that's good. And I'm glad that you've managed to achieve a few things since you came in terms of school. That's an objective you made very clear from the start, and you went for it. So are you still in that process, or done with it?
So I have finished my bachelor's degree in nursing. I finished last year, August. And I graduated this year, May.
Well, that's good.
Yes, I enrolled into another program, the diploma in sexual and reproductive health. I'm still doing it now. I'll be finishing somewhere next year. But again, I'm starting a master's January this year. Next year.
Wow. Next, January. Oh, yeah, in 1 week or 2 weeks.
In 2 weeks' time. So I'm starting by God's grace, I'm starting my master's in January.
Awesome.
Yes, January 12th, I'm having my first class, and it's a dream come true, and I'm so grateful to God.
Congrats.
Thank you
That's
very
really,
much.
that's progress. That's progress.
Yes. I thank God for the opportunities. Yeah.
Yeah. And by the way, while we're on that, would you mind talking about the things that you are allowed to do as an immigrant or as an international health worker?
For health and care workers, we are restricted into health and care work job. For example, if I'm not working for my employer, I work 37.5 hours per week. If I am not working for my employer, I am only allowed to work other 20 hours in another healthcare related organization or institution. So for example, I can go to a care home maximum 20 hours per week. I'm not allowed to work in a car wash, to work in a bank, or that kind of thing. No. You can't do that. But besides working the 20 hours in a healthcare related organization or institution, you can study. Studying is allowed. I'm not sure about opening a business. I'm not sure about that.
No, we can't, but the dependents can.
Yes,
can
the
do
dependents
that.
are free.
Yeah.
So I'm not, the business-wise, I think we are still restricted on that as well. But going to school, I'm sure, and working extra work, you can as well volunteer.
Yeah.
You can volunteer.
You can volunteer,
Yes.
yeah.
That one I am 100% sure because I've seen it. You can volunteer. For example, if there is, I have done one pancreatic cancer program. You can volunteer there, like maybe say in a shop or there's an activity happening, you want to be a volunteer staff, you can participate. That one is allowed. You can, but even Red Cross activities or British Heart Society, you can participate there. It's allowed under your visa.
Great. And the other thing I needed to check with you is the process of bringing a dependent. I believe when you came, you were alone.
Yes.
Have you managed to either bring a dependent or find someone from here? And how is that process?
Yeah, so I came to UK single. I got married about a year and a half later, and my wife comes from Kenya as well. So I went to Kenya, we got married, and immediately after we got married, we did the paperwork. 4 days later, she got the visa 6 days later. So 10 days later, we were here, both of us in the UK.
Oh, wow.
Yes. For marriage, for example, as long as you have the marriage certificate and you have other things that prove you guys have been married and living together, you can come. But we were newly married, so we had to give a bit more papers. So, for example, we had to show, apart from the marriage certificate, we had to show WhatsApp chat for the 1 year between the two of us. We had to show photos from our marriage ceremonies and the traditional and the church wedding. We had to show evidence of our parents meeting and even evidence of dowry payment. We had to give all that. We did the application that didn't have all that until they asked us for more information 2 days later. So as soon as we gave them extra information, the visa came another 2 days later. So it took us 6 days to get the visa.
Okay.
So, but if you've been married 5 years, 2 years, 3 years, they just want evidence that you've been living the same address, plus you're married. If they have any other question, they will send you an email and you will reply with more details. So it's not complicated. Same for children. They need your name. If you're both parents, they need your name to be on the birth certificates of the children. And that's all. That's all actually. And the evidence that you have a house support them. So for children, they need a bit more. If it's one child and it's a male, you are one parent, you need to show you have an extra room for the child. If you have a boy and a girl and they are like above 5 years, like the 9, 10, you need to show you have 2 rooms for the male and for the female. So you need to have a 3-bedroom house, for example. You need to appear there. So you need to show that. So there is you know how the UK is. You need to show that they have their rooms on their own.
Separate rooms.
Yes, because at 10 years they should be sleeping alone and not together like that. So you need proof of address and of course proof of your income as well. It is person to person depending on your situation. But we were newly married. It was very easy and quick. We got it.
Okay,
but
great.
But it is easy. I can assure you for partners, it's easy.
It's easy. And
Yeah.
did you apply the fast track visa?
No.
It's just a normal application.
Normal.
Oh, wow. That was quick. 4 days or 6 days. That was really quick.
6 days.
Yeah.
Yes.
Wow.
So maybe most of the people watching your podcast could be medics. They could be. Because of the blocked channels of moving to UK, part of what people are doing is this. For nurses, because it's difficult to get a job applying from overseas and it is no agency, what people do is, for us who did diploma in nursing in Kenya, for example, you can come to UK to do a top-up program 1 year. Within the same 1 year, you get your full registration in the NMC. And as you're doing your top-up here, within the 1 year applying for jobs, and as long as you're applying with your PIN, you get a job. In fact, I met a Kenyan here on Wednesday, a lady that came through that route. I didn't know she's just in my neighborhood here, but we met at the supermarket.
Okay.
But that's the route she used. She used the same route. So
Yeah,
you can come do a top-up, just save some money, come do a top-up, then you can get your PIN and apply for a job when you are here. At the same time, you could be working as an HCA Band 3 and you are earning money. So you can do most of the bills because you're working and you have experience and you understand the hospitals here and you can apply with their language because you understand what's happening in the hospital. That is number one. Number two, the other route is this. You save some amount, apply for NMC, do the CBT in your country, then apply for the, what do you call the other one? OSCE.
The OSCE, yeah. So
fly to UK, do the OSCE, then go back home. Then apply for jobs having passed your OSCE. And you have a PIN. So the NMC has registered you fully. You have the PIN already, but you're still working your job in your home country. So when you have your PIN already and you're applying for that care home, to that NHS, you can get a job quickly. Number two, prioritize applying to care homes and private hospitals because those ones have more chances to recruit you than the NHS right now as we speak. Yes, that's what I can say. But apply as many as possible because the more you do, the more you're increasing opportunity to get a job.
Yeah. Thank you for sparing the time and being with us in this podcast. How can we reach you?
Facebook, Jimmy Lionel Omaset. Instagram, Jimmy Omaset. And YouTube is Jimmy Omaset Nursing UK. Yes. So at some point, my YouTube had some challenges. I think last year around September or so. So there are no new videos for the last 1 year. But we have sorted that issue this year around August or so.
What copyright strike or what? What was that?
I think there was a hacking thing and so on. And then I was trying to upload videos. They were not going through.
Okay. So there was a problem there.
Yeah, but now it's fine. So actually, I have a plan. I have about 49 things to do from January on that channel. Okay. So Jimmy Omaset Nursing UK. I'll invite you for a chat.
Oh yeah, yes, invite me. Actually, there's one hack that that people should apply when dealing with the YouTube channels.
Yes.
You know where they ask you for your email, the email address to reach you.
Yes.
Never use the same email address that you used to open that channel.
Oh, okay.
That is usually the easiest way for hackers to hack your channel. Always use a different email address.
Thank you for
than the one you used to open the channel. Yeah.
Thank you for educating me.
Yeah. Yeah. So, but if it's still the same, just go and check. If it's still the same, you need to change it.
I'll change it.
Otherwise, it might happen again.
I'll change it.
Yeah. Anyways, so thank you very much. Thank you for sparing the time. And I know we will still catch up. The Eureka Health Podcast. I'm Toby, your host. Until next time, keep inspired and keep informed.
Yeah.